next thing we're going to do is invite our distinguished advisory board panel to come up to the table for brief discussion about the Bucksbaum Institute. You've already heard Dean Polonsky's lovely introduction of Dr. Holly Humphrey. I'll simply repeat that Holly is the president of the Josiah Macy Foundation and serves as the chairman of the board of the directors for the Kaiser Permanente School of Medicine. In other years, Holly was for 15 years, the Dean of Medical Education here at Pritzker. Well, there's a lot more to be said. She was chair of both the American Board of Internal Medicine and the American Board of Internal Medicine Foundation. So, Holly, please join us. Our next member of the advisory board is Dr. Jordan Cohen, who's President Emeritus of the Association of American Medical Colleges, the AAMC. Jordan was also the chair of the Arnold P. Gold Foundation. Previously, he had worked and taught as a nephrologist at various institutions. He and I met when he was at Michael Reese Hospital in the 1980s, but also at Brown University, Tufts, University of Chicago, the state of New York at Stony Brook, and George Washington University. Jordan is a member of the National Academy of Medicine, serves on the visiting committees of Harvard Medical School, the University of Chicago, University of Pittsburgh, and the Weill Cornell College of Medicine in Qatar. An internationally renowned leader in medicine, Dr. Cohen is former chair of the American Board of Internal Medicine and vice chair of the Board of Regents of the American College of Physicians. He served on the editorial board of JAMA. Jordan, please come up and join us. And third, Dr. Arthur Rubenstein, professor of medicine at the School of Medicine at the University of Pennsylvania. Previously, Dr. Rubenstein was the executive vice president of the University of Pennsylvania Health System and dean of the Perelman School of Medicine from 2001 to 2011. Before joining the University of Pennsylvania, Dr. Rubenstein had served for 4 years as the dean of Mount Sinai School of Medicine in New York. For 15 years prior to that, as many of you know, he was the Lowell T. Coggeshall Distinguished Service Professor of Medical Sciences and the chair of the Department of Medicine here at the University of Chicago. Dr. Rubenstein is an internationally renowned medical leader, as well as an endocrinologist recognized for his great expertise and groundbreaking research in diabetes. Well known for his inspired teaching, Dr. Rubenstein has served in many professional leadership positions during his career. So Arthur, if you would join us, please. The fourth member of our board, Laura Roberts, who's the chair of psychiatry at Stanford and a graduate of the Pritzker School of Medicine, who was unable to join us for family reasons today. And so I'm delighted to have this wonderful panel, and I'm maybe going to ask Holly if she would say a few words about the Bucksbaum Institute.
Wow. Well, this is one part of the University of Chicago where I can say I was here when it was created. And I well remember the day when Kay and Bob Zimmer and you stood across the street in the Biological Sciences Learning Center and had the press conference to announce this. And within a matter of just a few hours and days, I began hearing from colleagues across the country largely expressing their jealousy about why we had the chance to do this and they didn't. And so now to have the real privilege of looking back over these last, is it eight years, it's really, to me, stunning what the Bucksbaum Institute has been able to accomplish. And I think the issues and the challenges are even more urgent than they were 8 years ago in terms of the many threats to the doctor-patient relationship, the real imperative to elevate attention to the doctor-patient relationship. And I think over the course of the afternoon, we heard elegant presentations about what we can learn from our patients to help us do that work.
Thank you so much.
Well, good afternoon, everybody. Of course, being with two of my distinguished colleagues here and having been here, I guess, for 8 years each year to see, it's really gratifying to see how the Institute has flourished and really had an impact first here, but more recently nationally and internationally. I think Kay had a vision, and her husband, about how this could work. And of course, Mark and Angela and Matt and others have, and Holly when she was here doing it, have actualized it and put it into practice in a way that's really quite remarkable. The University of Chicago is kind of a small place, but its impact is enormous around the country and, as we can see now, around the world. And so it's really gratifying to see that. The Institute deals with a really, really important topic, and it folds in well with things like clinical medical ethics, which also began here in a real sense, and other important relationships with patients. And so having these all together magnifies the impact, and I think around the country, as Holly said, there's envy about what a small group of people with a vision and a philanthropist can really accomplish. So we should all be very, very proud and, really impressed by how this thing has unfolded. And the next 8 years will be very challenging. I wouldn't say the first 8 years were easy, but they did all the things that you should do to be right. And now the challenge will be to even make it greater by a variety of new challenges that we talked about today. So I wish you all good luck, and I'm always very happy to be here.
Well, we could spend a long time talking about the accomplishments of the Bucksbaum Institute and their self-evident. I'm going to take a little sort of higher view, a 30,000-foot view. There's been a lot of changes in medicine, certainly since Arthur and I began our careers about 150 years ago, collectively. But one of the things that I don't think has changed is that medicine still appeals to people who come to this profession because they really understand the professional gratification that can come from dealing with patients and helping people through difficult times. That the joy that comes from that kind of interaction, that kind of relationship, is what really motivates it. I think virtually all students who come into medicine now, as was the case forever. And I think one of the things that we all realize is that, as Holly pointed out in her remarks, that the systems that we put ourselves through and put our students through in medical school and residency and obviously in practice threatens that sense of joy because of all of the externalities that encroach upon the time and encroach upon the ability that we have intrinsically to do the right thing. So I think the need to become as resilient as possible to withstand those pressures, those threats that undercut the joy that comes from medicine is really a major challenge for medical educators. And I think what the Bucksbaum Institute has done, what the culture of the University of Chicago as a result of that and other initiatives has done is to ensure that the students and residents and faculty who are involved in this institution experience that increased resiliency because of the emphasis, the cultural value that's placed upon the doctor-patient relationship, which I think is exceedingly important in order to keep that passion for patient care alive. And I think that's one of the things that I think, broadly speaking, the medical profession in this country, until it's able to be totally reformatted so that these pressures are reduced to the point that people can continue to experience the basic gratification that comes from this profession, until we are able to restructure the system so that it supports that kind of care, we depend upon our internal resources to keep that passion alive. And that's a difficult thing to do, but I think it's what I think the programs of this institute are fundamentally aimed at.
So I've been thinking whether I should say this all day, and I think the answer is no, I shouldn't, but I will anyway. So one of the things I've been thinking about related to what Holly's presentation, which, by the way, was beautifully crafted as always, and then Jordan's comments is, are what we're doing to try to improve the system of medicine, which goes all the way down to those circles you mentioned and then the outside influences, are we really able to affect a significant change by all these, I wouldn't call them small, but certainly incremental tweaking of the system? So we do this and we do that. But fundamentally, medicine is kind of at the moment, and I regret to say this to everyone, but one has to be, at least personally, it's really run by money and a kind of a outside the medical profession power. And doctors suffer from not just the money issue, but how it relates to time, which involves patients. And Jordan and I were saying that. So if that is really true, then many of these changes that we are able to do will improve things, or might, on the margin. But will they really make a fundamental difference? And that brings me to the question is, do we really need a revolution in medicine and change the whole system before things are really going to get better? And, it's not like that's such a pipe dream, because maybe 20, 25 years ago, medicine actually was practiced quite differently. But a whole variety of things changed, and particularly the money structure in medicine became a very dominant thing, a $3 trillion economic, 18% of our GDP. And so the question really is, people are talking about Medicare for all. I have no idea if that's possible, who'll pay for it. I'm not smart enough to know all these things. Or the Canadian system or the Scandinavian system is so much better, or this or that. But I am worried that we will spend a lot of time on incremental changes that in the end will have a minor effect. And we need to be really bold and challenging and really think about, particularly young people, coming out there, all of you, and saying this is enough, we've got to change the system so we really can practice in the way that we want to and that patients will benefit from. So it's a challenge, I don't know if that's right or wrong, but I'd be interested in other people's opinions, and particularly Holly and Jordan, who've thought about this a lot, whether that's too pessimistic approach.
Well, I certainly do not think it's too pessimistic. And in fact, you heard me say from the podium that I'm personally feeling a certain sense of urgency, because so many of these issues that I spoke about, and I could share thousands more examples, have been with us now for decades. And it was almost 20 years ago when Ken Ludmer wrote about the need for the second revolution in medical education. But we cannot have a revolution in medical education by itself. We need the revolution with medical education in the whole healthcare system. And once a few months ago, Arthur, you asked me how many medical students there were in this country and whether or not we could stage a revolution. And I've been thinking a lot about that.
He's some kind of person.
I mean, I'm thinking if we mobilized all the students and all the residents all across America, would we be big enough and powerful enough to take on big pharma, which, the pharmaceutical industry is the largest lobbying group in Washington, but you'd never know it if you look it up online because they divide themselves into these little pieces, and only if you add them all up do you see how big they are and how powerful they are. So are we, as a profession, and of course, think about the nurses and all the other healthcare professionals who are in the same dilemma. In fact, the more I've thought about the talk you heard me give, the more I realize it's about a major moral dilemma that happens over and over again. And the moral dilemma is actually written mostly in the literature, in the published literature, from the standpoint of nurses and the positions that nurses have been placed in over time. And then there's this concept of moral residue, which I think is a big factor in burnout. So I'm ready for a revolution, and I'm looking for a few willing hands that together will be powerful enough to take on the really big money in Washington. Let me just ask one other.
Number two to join me.
Oh, wow, we could do big things. Let me ask, how many people in the room have seen the YouTube videos of Simon Sinek? Actually, the one I'm thinking is about leadership. So Simon Sinek is a fabulous innovator, and he tells a very compelling story, and maybe some of you know it, about how powerful it can be when you have passion about your purpose. And the example that I did not know about until I listened to him was when the innovation of the time was to develop an airplane. And there were two major groups of people working on the development of an airplane, but only one group was known about, and that group was led by a very important physicist at Harvard. And that physicist at Harvard had hired the very best minds from all around the world to help develop an airplane. But it was also well known that he and his team were regularly followed around by the New York Times. Those who knew him well said that he was primarily voted by money and prestige. And he got a little carried away with that, apparently. Meanwhile, in Dayton, Ohio, at a little bicycle shop, Orville and Wilbur Wright, running their bicycle shop, not known to the New York Times, were trying to figure out how to make something fly. And when they accomplished their goal, the New York Times wasn't there. Nobody was there. It was just the two of them. But it was a wonderful story about the power of and passion of purpose. So if we're all in this together, we could perhaps make an airplane fly and really change the whole healthcare system.
Let's do it.
Right on.
I'm going to make one last comment. If you just want to read about why this is so challenging, in this week's New England Journal, there's the beautiful authoress, Daniel Humphrey, who writes so beautifully. She's a general internist, and she just sees patients a lot, and then she's able to write in a succinct, rather beautiful way what it's like these days to take care of complex patients. So I'm not going to tell you what she wrote, because it's just too difficult, but she points out why it's so challenging and the frustration and difficulty she has, and you could multiply that up by millions of encounters. And so when I read that, I came back to the conclusion we need this revolution, because incrementalism would not solve her problem, and she's like my hero, the center of what's wrong, and she can express it, and we need to see what's right, and we've got to change the system, I think. All right, we're done.